And I'm definitely sure that like there's a lot of maybe like special cases or there's a lot of like outliers in like maybe patients that you've had. So could you talk a little bit about those?
Sure. So sometimes what happens is when people are struggling with OCD or other health issues, or if they've gone through a lot of trauma, say for example, in their life, or if they have any other issues where food eating becomes a way of their coping with different things, then what we try to do is see which is the factor that is more difficult to deal with. So, like we suppose the trauma is very, very intense. We try to address the trauma first. We try to address the OCD first, so we can, bring them to a place where they're calm enough to address these things, right? So, because otherwise they may suppose somebody is dealing like with the trauma. I cannot tell them, can you please stop uh, eating 5 pieces of bread? They're going to say, no, I cannot stop because they're eating to fulfill the trauma in their brain, right? So I have to help them to understand how to deal with the trauma first and slowly come to the place where we address the behavior. So that's like one of the outliers that we have to deal with. And if it is, and even if the body dysmorphic disorder, where they feel, okay, I'm so fat, I'm so fat, I'm so fat, then I have to bring them to a place where they're able to be aware that they are not necessarily fat, or they may not be necessarily thin, but it's like they can be happy with the way they are and do different things. Bring them to that place, and then the eating as a behavior can be addressed.